sorry to cut you today. It looks like the awareness hasn't actually gone down well.
No.
In fact, the people
No.
that should know are even the ones that are causing the worry.
That's right.
With the new story about a corpse that
Exactly.
has been flown in, not even through the land
That's right.
border, from Liberia.
Right, from Liberia. Why would they? That is so dangerous, and that corpse may definitely be infected. We said dead bodies and live people are infectious. So why would the corpse pass through the border? So we need a lot of education. We need to educate all the people on our borders. We need to set up isolation centers. We need to have mini labs testing people. You know, there's no reason why we have one testing reference center. No, it's not going to work for the whole country. Nigeria is big. Each state needs to have, even if you say okay, per state, let's not do local government for the testing. At least every state needs to have one good reference center, and all the other ones will be trained to, you know, collect samples and send. And quarantine people in the isolation centers. We need something like that. We need something like that.
Do you think we're just in panic mode?
No, I don't think so. I think we are underrating this. If you watch the videos, you'll notice that it's really getting severe. It's severe because I can tell you that the United States has even mentioned that some of these volunteers are going to be withdrawn, that they're exhausted. They don't want any more volunteers exposing themselves to the virus. And once you see people withdrawing aid, that says a lot. We need to do something, and we don't need to wait until we see 5, 4, 6 cases. In South Africa, nobody waited. They had an outbreak of what looked like a viral hemorrhagic fever in 2008, and we have the research documentation. And the epidemiology department decided that, first case, second case, and they all died immediately because, of course, they were just doing what they were doing. So, just give fluids, you know, just palliative. Let's all protect ourselves. They all died. The 5th case, they said they isolated a virus called arenavirus, and that is in the same group as Lassa fever. You know, but this one wasn't causing bleeding, but the symptoms were all similar: vomiting, diarrhea, fever, headache. You know, the patient even had convulsions. So they just got hold of a drug, and they said, this antiviral drug is broad spectrum. Let's give it. There was no history. There was no research that said this virus is susceptible to this antiviral because, of course, it was a mutant of an old virus. They administered, and this woman got better within 24 hours. I think she made a good recovery according to the research article, and she was good. And that was how they stopped that outbreak. So what are we doing here talking about, you know, washing our hands? And yes, we're going to have to wash hands. Yes, we're going to have to use PPE. But what about the American doctors in Liberia? They were all using PPE. And they still got infected. So that's not the solution. The solution is to be proactive about it. For sure. We may have cases right now we don't know anything about because reporting is what gives us, you know, the data. If we don't have it reported, we're just going to, you know, suppose that there's nothing going on.
Yesterday, too, we also got to hear about, is it a cure? We had bitter cola, we had cola nut. We're seeing cola nuts on the papers here.
I'm not sure there's any research evidence for the herbal. There is research evidence for the ribavirin. I'm talking about this antiviral. There is a research evidence. I even have a university in Helsinki, Institute for Biotechnology. We have Kariman and Magden, and some other researchers. They actually wrote a very good article based on their research that these are the antiviral agents you can use for these viruses, and they listed Ebola against ribavirin. So what are we doing? Why are we sitting around here waiting for inevitable? The response here to the epidemic, we obviously seen that the response is poor. Otherwise, it won't be spreading. Once viruses start crossing borders, it means that we haven't contained it yet. So we need to do something definitive, not just, if anybody falls sick, go to the health center, we're going to isolate them. How many isolation centers do we have right now? None. As far as I'm concerned, just 1 or 2, maybe in the urban areas. Rural areas, what do we have? We haven't got, the infrastructure is not there. And if you say, it's about no contamination, what about people in the buses? Don't they sit beside sweaty people? So how do you stop that from going on? How do you stop people who live in slums, don't have any running water? So you say, wash your hands. Where's the water? What about the housing? We all know that people live in houses that 10, 11 people live in 2 bedrooms, in one room apartments, because they're poor. Poverty is a problem. So you haven't got the infrastructure for this strategy. No contact strategy. We don't have it. We don't have the water. We don't have the housing. We don't have the transport system that can give people rooms. You don't have to sit next to somebody who's sweaty, obviously. We just don't have it.
What should we be doing now? Because if we look at it holistically, one would have thought with all the awareness that we have given so far, yes, and the supposed precaution, especially at the airport, I'm using the word, yes, supposedly now, because of what has happened again, for a corpse to have actually gone through security from Liberia, so causing a lot of panic and concern. Yes. What should we be doing now?
Well, right now, we need to increase the awareness. The level of awareness is low. Lots of people, they're frightened. They don't know what's going on. And the information it's a bit, disjointed, it's scattered. We need a very focused campaign. Let people know what they ought to do. Set up the isolation centers, first of all. If you notice this, go straight to the isolation center. If your member from family has this problem, don't keep them at home. Take them to the isolation center. Of course, if it's walking distance or something they can get on a bike and get there, it will be feasible. But when you say, go to the city and take this person who is ill, it's not going to happen. So set up this isolation center and have, like I said, a central lab in each state or a few local governments where they can test people and say, you have it, you don't have it. Right, you take this antiviral and start it. None of this business of, let's pray and let's just protect ourselves. That strategy isn't working. If it was working, the virus would not be crossing the borders. So that's why I say...
So you think that we can actually take preventive measures?
Yes, we can take preventive measures because there's research evidence to support it. If researchers in the University of Helsinki in Finland can come up with a list of antiviral agents you can use against viruses, and they actually listed Ebola in their article, that this Ebola, pox, this and that. And of course, if you look at the structures of these viruses, the first virus that the drug was used for was RSV. That's a respiratory virus. And this RSV is an RNA negative virus. This Ebola virus is an RNA negative virus. They're the same structure. And usually when you talk about, response in terms of therapeutic, you look at the structure. Okay, with this drug, okay, what is there in the bacteria or the virus?
So you look at the similarities.
Yes, so there's a lot of similarity, the RSV, and then even the hantavirus. And hantavirus also has research evidence. Hantavirus is a larger virus than Ebola. Ebola is like 19 kb, that's the length. And Hanta is about between 12 and 23. And they have research evidence for the response from Hanta. So why on earth, and that's RNA negative as well. So of course the researchers said you can use this against Ebola and it's listed in there. So why are we waiting here? Because when there's that research evidence for an intervention, we don't have to invent the wheel. Just start. And South Africa, they didn't wait for anyone to say, this RNA is a mutant, you have to research it first. They just took the drug and gave it, and they saved this lady's life, and they stopped the spread immediately. So we need to stop the spread. We're not going to sit by and do nothing. I don't think that's the strategy we should adopt.
But do you also think we should roll out herbal medicine?
No, I don't think until we have, because we have medicine, we don't have any research evidence. Like I said, evidence-based medicine, what we should practice. Right now, we have enough evidence for the antiviral. We do not have any evidence for herbal. I've searched all the databases. Before I came in here, I searched databases, and I did not come across any herbal mentioned. All I saw was the antiviral that was mentioned, and which responses they've been getting. Lassa fever is very similar, although it's not in the same group in species, but at least it was responsive to this same antiviral. So I think that's the next level. We can't sit down here and do what Sierra Leone and Liberia. They've lost thousands of lives, even the ones that are not reported. So I don't think this is the time to sit back and do nothing.
And people are still dying.
People are still dying.
Even though now
we need to take this to the next level.